Hi, I'm Kaylee Nelson, and I'm from Bend, Oregon, and I'm currently a sophomore at Seattle Pacific University, where I'm majoring in applied human biology with an emphasis on pre-PA, and then I'm also a psychology minor. I've always been really interested in healthcare from a young age, and I think my involvement in athletics really fostered that. Unfortunately, I was injured a lot through sports, and I'd find myself in the ER and even having surgeries numerous times. And so I was really interested in how the doctor was diagnosing me, what was wrong with me, and what he was going to do to get me back on that field. Through my time at the doctor's office, I realized how altruistic this field is and how it's really your main priority is about getting your patients healthy so that they can get back to doing what they love. And I've always really enjoyed helping others. I think the self fulfillment that you get from helping others is unmatched. So this was definitely a career that interested me. Additionally, I am very much a people person, and so I knew that I needed a job where I could have that human interaction. And in the medical field, you get a nice mix of science as well as human interaction. So I was interested in that. Um, Another thing that really interested me in medicine in particular is that I'm an avid learner. I really like learning new things, and science and medicine, it's always changing, it's always evolving, and you always get to learn new things. That way you can be the best doctor. I think the last reason that really put me into healthcare too was I knew that I could not work in a desk space all day. I would get bored and I don't want to do the same thing. That just wasn't me. I'm a very active person and I need a job where I can be running around and having a variety of things to do. And as a doctor, each time you go in with a new patient, you have a whole new problem to solve and you get to see that variety, which really intrigued me as well. I think I really got interested in medicine was when I got to shadow in the live birthing center my senior year of high school and I got to watch a live birth. And that was amazing and so cool, and it gave me such a huge adrenaline rush. And at that point, I realized that this was a career for me. I needed to find a place where I got this much of an adrenaline rush and where like going to work wouldn't feel like work because it's so much fun. And then coming to SPU and studying coursework in human anatomy and physiology, I realized that, yeah, reproduction and women's health is where I need to be because it's what I'm truly passionate about and eager to learn more about. And that's why I've decided that I want to become a physician assistant in OBGYN.